Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. NCDC promises support to the National Youth Service Corps to help mitigate the impact of COVID-19 on Youth Corps members across the country. Edo State warns against self-medication, says some of the COVID-19 related deaths could have been prevented if proper medical attention was received. And Sweden removes most COVID-19 restrictions despite rising case numbers. According to the Nigeria Center for Disease Control, 2 deaths were reported in Delta State on September 23rd and September 26th, while it also reported that 6 persons died of COVID-19 related complications, bringing the total fatalities in the country to 2,695. Meanwhile, 317 people were discharged after recovering from the infection, putting the total recoveries at over 193,000 across the country. Here's a look at the virus update.
295 additional persons in Nigeria have tested positive to COVID-19 in the last 24 hours. According to the Nigeria Center for Disease Control, the latest figures were reported from 19 states and the FCT. This is a decrease by 1 from the figures reported earlier. The FCT logged the highest number of infections with 81 cases, followed by Gombe, which had 43 cases. 32 cases were recorded in Osun, 25 in Kaduna, Rivers had 20, Delta 17, Edo had 14, while Ogun had 11 cases. Oyo and Plateau registered 9 cases each, Akwa Ibom and Bayelsa logged 7 cases, Zamfara had 6, while Kano had 4 cases. Other states that reported a single-digit infection include Ondo, Abia, Nasarawa, Benue, Ekiti, and Niger. There were backlogs of 2 deaths reported from Delta State for September 23rd and 26th. The overall count of confirmed cases in Nigeria now stands at 205,047. 317 people have been discharged in the last 24 hours, increasing the total number of recoveries to 193,260. Lagos is still leading the chart of states with the highest number of cases currently on admission, followed by the FCT, Delta, Edo, and Oyo states. 6 additional deaths from COVID-19 complications were reported in the last 24 hours, raising the fatality toll to 2,695. Presently, there are more than 9,000 active cases in Nigeria, while over 6 million samples have been tested so far. Over 4.7 eligible Nigerians targeted for COVID-19 vaccination have been reached with the first dose, while over 1.8 million persons have been fully vaccinated so far. In Africa, there are more than 8.2 million confirmed cases and over 210,000 deaths recorded across countries on the continent. The total global confirmed cases have now surpassed 232 million, while deaths are beyond 4.7 million.
And the outgoing Director General of the NCDC, Dr. Chikwe Hekwazo, is promising support to the National Youth Service Corps to help mitigate the impact of COVID-19 on Youth Corps members across the country. Speaking during a meeting with the Director General of the NYSC in Abuja, Dr. Hekwazo underscores the importance of the scheme to national integration as part of the reasons why the agency fashioned out measures to ensure the continuation of the orientation scheme. On his part, the Director General of the NYSC, Brigadier General Shuaibu Ibrahim, praises the outgoing NCDC boss over his tenacity in combating the pandemic.
Risk is never absolute. It is relative. You can mitigate risks by taking decisions that will limit transmission in the context of the benefits of the program. So if we had, I can't imagine where the country would have been if we had 2 years of pausing this critical program for the country. What impact it would have had on our education system, on our health system, on our service provision. So really, by working together with you and your team to insist that we continue the program in a adapted way in order to respond to the challenges of our time. That is really what leadership means. So really, on behalf of all Nigerians that are beneficiaries, participants, and co-collaborators on NYSC, because it is the one scheme that all of us that have gone through tertiary education in Nigeria have participated in. So on behalf of all of us that are alumni of the program, I'm really grateful for your leadership, because as we addressed young people, I think we have done it 4 times in the entry of the program, they would have been surprised on what it means and the efforts that we have put into making sure the program continues.
The Edo State government is still urging residents to take the COVID-19 vaccination to boost their immunity against the virus. According to the state's COVID-19 response team, this third wave has been the worst phase of the pandemic so far in terms of the number of deaths recorded. It adds that the figures might be more than what is being announced because data is only collated from the established COVID-19 treatment facilities in the state. Meanwhile, 3 deaths were announced in the last 24 hours.
Stella Ambassador Teaching Hospital, University of Benin Teaching Hospital, ISTH, and Auchi Central Hospital Isolation Centers. These are the locations we are recording our figures from. And that tells us that many other persons out there are certainly dying from this COVID. So when you see these figures, and it seems as if there are not so many, it scares us, the professionals, the public health teams here, that we are losing so many persons out of preventable causes. These measures we are putting in place in those states by saying that people should comply with the non-pharmaceutical measures of wearing face masks, avoiding crowds, keeping social distance, as well as washing your hands and use of sanitizers, are put in place to reduce the transmission of this virus. And then, for those who are sick, please stop patronizing chemists and pharmacies around you without seeking proper diagnosis from a facility with proper personnel. That means a hospital, whether public or private, where the appropriate personnel are in and they have the means of testing to confirm whether there is COVID or no COVID. We know that other things will be tested when you go to the hospital. That's saying we need to have proper diagnosis to be able to get the right treatment done or given.
According to the NCDC, Kwara currently has 3,791 confirmed cases of COVID-19, with 80 currently on admission. Since its first outbreak in the state, it has recorded 61 deaths from COVID complications. However, following the vaccination rollout in March, officials have described the exercise as one that is yielding results, as they have recorded a high number of vaccination with minimal side effects. Well, joining us now for more on the drive there is the state's Executive Secretary of the Kwara State Primary Healthcare Development Agency, Dr. Nusirat Elelu. Thank you for joining us on the program.
Thank you for having me. It's my pleasure right here.
All right. Tell us about the progress of the phase 2 vaccinations in the state.
Okay, thank you very much. Kwara State also joined the rest of the country to roll out COVID-19 vaccination for second phase. We have currently 2 types of vaccines, the AstraZeneca and the Moderna vaccine. For the Moderna vaccine, we receive about 102,000 doses, and so far we have vaccinated over 50,000, which is 50% of our vaccines, and we have currently running for the second dose of the second phase. For the AstraZeneca as well, what we try to do is to cover those people that had vaccines during the first phase that hadn't had their second doses, as well to also cover additional new vaccination. So 91,000 AstraZeneca were also received, and over 50,000 has so far also been vaccinated in Kwara State. So the uptake has so far improved, of course, because we have had several communication strategies that ensure that quite a number of people that should be reached so far, are now converts and now agreed to take the vaccine. And of course, because we don't have, cases of adverse reactions, that, so to say, discourages people from taking the vaccines.
Are there places that are hard to reach areas? How are you getting the vaccines to the most vulnerable there? And did you also receive the J&J vaccines?
Okay, so far we've not received the J&J's vaccine, which is the single-dose vaccine that was actually targeted at those in the hard-to-reach areas. So in the interim, what we do is that we have what we refer to as the temporary fixed post or mobile posts. So these temporary fixed posts, usually we have a daily implementation plan that will enlist the communities that are going to be vaccinated at every point in time. And so we have those posts that visit those hard-to-reach areas based on what is on their plan for that day. So we have them in clusters of vaccination. So that's what we are doing so far to ensure that people in the hard-to-reach areas, are covered.
Now, published research data in low and middle-income countries show that vaccine acceptance is explained mainly interest in personal protection against the virus, also concerns about side effects, essentially the common reasons for hesitancy. But it also showed that health workers are the most trusted sources of guidance about vaccines against COVID-19. In your estimation, your health workers in Kwara State, are they up to the task? And perhaps another question is, have they all been vaccinated?
Okay, thank you very much. Of course, COVID vaccination, just like we have with every other vaccination drive, including childhood vaccination exercises, we always have people that, have some reservation in taking the vaccine, and it is not unexpected. So what we try to do is to continue to engage to ensure that those people, get convinced to have the vaccine, especially now in Edo State, we are having cases of people that have died from the virus, mainly those that have neither been vaccinated or have been partially vaccinated. So that is some evidences to show that vaccination is one of the most efficient and, safe method against the COVID-19. So as against the health workers, yes, we have some hesitancy, especially when we started the vaccination exercise in Kwara State. But, currently we could say that quite a number of our health workers have been vaccinated against COVID because they are frontliners. And we continue to ensure that our frontliners are also protected against the virus.
My final question is, what happens to the vaccination waste? Are they thrown out? Are they burned? What exactly?
The waste from vaccination. Okay, so we have what we refer to as reverse logistics. So in reverse logistics, the way we deploy the vaccines to our various health centers is the way they also come back from the health center to the ward collection site, to a central local government location, to the state location. So we have, for those bundle vaccines, we have the syringes and etc., where we have them by incineration, and while the vials themselves, we use the method refers to as the boil and bury. So what we do is to boil them at very high temperature where it neutralizes whatever virus is there, and then we bury. But sometimes we also have some after burying. Before burying, we can actually do crushing. So those are some of those ways where we dispose of waste from vaccines.
All right, we appreciate your time on the program. Wish you the very best in the rollout of vaccines. We've been speaking to the State Executive Secretary, Kwara State Primary Healthcare Development Agency, Dr. Nusrat Elelu. Thanks again for joining us on the program.
Thank you for having me.
Well, still to come, in an effort to boost the African continent's vaccination drive, Algeria starts COVID-19 vaccine production. Please stay with us. The Ebonyi state government says it will not spare any efforts in combating the third wave of COVID-19 in the state. Secretary to the state government made this known as he gave an account of current efforts by the government targeted at curtailing the spread of COVID-19.
Of course, the Ministry of Health our Center for Disease Control has not told us that COVID-19 is no more in the country. So we have always been very proactive, and the Ministry of Health and the committee in charge in the state have been up and doing to make sure that proper hygiene is being maintained, the protocols are being followed, and I know that sensitization and awareness campaign has been in place to make sure that our people survive the same way we survived the first and the second wave. I know God, with His infinite mercy, will help us to survive the third wave. It's just for our people to follow the protocols and make sure that they observe to do all they were required by the bodies in charge.
Away from Nigeria, Algeria is starting to produce Chinese-developed Sinovac vaccines for its own use and export to other African countries. The government says the production will be done in partnership with China and state pharmaceutical products company Sidel. The country plans to produce 1 million doses in October, 2 million in November, and 3 million in December. The goal is to produce 5 million doses per month starting from January 2022. And over the last year, it has now been evident that the impact of COVID-19 is way beyond influenza-like conditions. It has been realized that COVID-19 affects many more organs and not only the lungs or the respiratory tract. One such organ is the heart. Every year, the World Heart Day is observed on the 29th of September to spread awareness about the importance of keeping the heart fit and safe from any cardiovascular disease, CVD, and stroke. According to the World Health Organization, more than 17 million people die from heart disease every year, and CVD is responsible for at least half of all non-communicable diseases deaths, hence making it as world's #1 killer. Dr. Peter Moesi, research fellow at University of Aberdeen, joins us now from Scotland. Thank you for joining us on the program. When a patient tests positive for COVID-19, how is the heart affected?
Thank you for having me, Millicent. When it comes to a patient testing positive to COVID-19, it depends on the progression of the disease. So the first thing is the individual at the level of mild or severe? Now, initially, in the early days of COVID-19, we initially thought that the SARS-CoV-2 virus was a respiratory illness. But over time, we now know that it has the capability to infect the lungs, the heart, and other organs within the body. So the way it works is when an individual is positive to COVID-19, you have a lot of damages within your lung cells. And once you have accumulation of fluid within your lungs, it therefore leads to clog within the system, reducing the level of oxygen flow through the bloodstream to the heart. And that leads to excess pressure within the heart muscles to produce more blood in the circulation. That is one. We also know that SARS-CoV-2 do have the capability to cause some damages within the blood vessels within the lungs, where that can actually lead to blood clots. And it depends on where you are, basically. So you could have stuff like deep vein blood clots, thrombosis. You could also have pulmonary embolism as well. So these sort of peculiar situations, when it comes to severity and critical cases, can actually impact the functionality of the heart overall, and that can also actually lead to fatality of that particular individual.
It's really interesting how the degree of this can vary from person to person. We also hear that after recovery, many patients have reportedly rushed back to hospitals. They complained about reduced heart functions, heart attacks and strokes. Some have even complained of varied heart rates, breathing issues, chest pain. I mean, what are some of the things that perhaps one can do, having recovered from COVID-19, to keep the heart fit and healthy?
So when it comes to the heart, it really depends on a number of issues. So if you have a very well-functioning heart, then that is really a good thing for that individual. So first, you need to understand if you are fit when it comes to your heart status. At the same time, when it comes to how to avoid such heart-related issues to COVID-19, well, the first recommendation is for you to get the vaccine, because we do know that the vaccines do have the capability to limit severity hospitalization, and death. And these are the sort of issues that you could have when you are exposed to SARS-CoV-2 virus. So the first thing is go for the vaccine, and you are protected from such complications such as long COVID. Also, when it comes to how to keep the heart functional, when you also have areas like exercise, so you could do more or regular exercises on a daily basis. Then also, I think I will also advise for people to take more fluid on regular basis as well. Then also do check with your cardiology to ensure that your heart is in the right status. And based on that, you can be rest assured that your functional system is well in place at all times.
Finally, how common is heart injury? And this is across the spectrum of the SARS-CoV-2, from asymptomatic cases to critical disease.
So really, it's really based on the level of exposure, and if you are asymptomatic or if you are symptomatic as well, and if you get to the level of severity and critical cases. So take, for instance, if an individual is exposed to SARS-CoV-2 virus and that leads to high level of, let's say, viral load that could actually impact your lungs, thereby playing a significant role in the pressure on your heart, then that is really a big issue for that individual. So when it comes to the SARS-CoV-2 virus and the infection of this particular individual, you need to put into context if the case is severity, if the individual is asymptomatic, and if the individual do have other comorbidities as well. Also, we do know that when it comes to the SARS-CoV-2 virus, people who are exposed when it comes to asymptomatic, you can't really say if you have damaged lungs or if you have damaged heart as well, because until you go for a thorough medical check before you can say of a truth, based on my initial exposure, despite it's asymptomatic, my heart and the muscles are still in shape and intact.
All right, we appreciate your time. Thank you so much, Dr. Peter Mwesi, for joining us this Heart Day to talk about COVID-19 related issues and the heart. Thank you so much.
Thank you for having me.
Sweden has lifted all COVID-19 related restrictions in the country today, announcing that the pandemic has been brought under full control after Denmark and Norway. Sweden is the third Scandinavian country to totally abolish coronavirus related restrictions. According to the statement, rules such as wearing a mask at airports and on planes where international rules apply, as well as PCR testing, will continue to be enforced. Here's more on the global COVID-19 update.
With most adults vaccinated, Sweden has removed almost all pandemic restrictions despite rising case numbers. As of today, pandemic restrictions no longer apply to bars, restaurants, and events. The country has been an outlier in aspects of its handling of the disease, shunning hard lockdowns throughout the pandemic, relying instead on recommendations regarding issues such as social distancing and hygiene. Russia has reported 857 new coronavirus-related deaths, the most in a single day since the pandemic began, and the second day in a row it has set that record. The government coronavirus task force also reported 22,430 new COVID-19 cases in the past 24 hours. New Zealand has reported 45 new cases of COVID-19, all in the biggest city, Auckland, taking the total number of cases in the current outbreak to 1,230.
While the overall number today is obviously a lot higher, it is important to note many of these cases are linked to our existing cases, and in some sense they were expected. But even more important is that we found these cases because people have come forward and been tested. This is essential for us to know what we are dealing with, and high levels of testing across Auckland tell us that. So thank you to everyone again who has been or is being tested.
New Zealand eliminated COVID-19 last year and remained largely virus-free until an outbreak of the highly infectious Delta variant in August led to a nationwide lockdown. Auckland is still in lockdown, and new cases are being reported every day. About 43% of eligible people are now fully vaccinated. Egypt is now providing immediate COVID-19 vaccinations at youth centers across the country without prior online registration, a step aimed at encouraging vaccinations and relieving pressure on hospitals and health units and a fourth wave of infections. The Health Ministry says nearly 270 youth centers are now open for citizens to get the vaccines, bringing the total number of vaccination sites across the country to 1,100.
It is important to limit the risk of COVID-19 infection among all ages. Continue to take responsibility. Visit our website for more updates, a better understanding of the pandemic, and you can find breaking stories there. It's channelstv.com. And that's the program this evening. Thank you for watching. I'm Millicent Walker. Stay healthy.